hospital. Oh, you want me to wait?
Well, go ahead.
Okay. We have been working with lily pads now for like 3.5 years or so.
Something like that. Yeah, it's been a while.
And we've gotten to learn a whole lot about the special needs that you guys have, dealing with bulldogs in general, but also bulldogs that are rescues. And you guys are kind of your own little subclass. It was really interesting doing just additional research on CPR and finding out the things that were very specific to bulldogs. So I've incorporated a lot of that into our presentation today. I do have copies of all the slides that I'm going to hand out to you guys afterwards, so you don't have to take copious notes or anything like that. And then I also have a handout from a really good reference called veterinarypartner.com. They have a great breakdown for CPR, but it's also a good reference for any first aid questions you guys might have. There's actually a list on the side of all the first aid things that they've done a really good job of fleshing out to answer questions you might have at home. So if you have to do Dr. Google, use a good source. I'm also going to have a sign-up sheet up here, so if you guys have questions at the end or things that you specifically want to know more about, and you don't have time to talk to me, or you're like, yeah, you know, just email that stuff to me. I do have a form up here where you can just send me your email and any questions that you have. So that way I'm happy to communicate with you. I can send you a copy of the slides via email too if you prefer to have it in that format. So can you guys see the screen okay? Like I said, it was a lot bigger in my head at home. But we're going to talk about cardiopulmonary resuscitation. And just to kind of start with, we want to make sure that communication with CPR is one of the most important things. We want to make sure that there's a clear plan within your family and within your rescue organization. So if you guys have someone in your care and they have medical issues, we want to know, how far do you want to go with CPR? Like, are you okay with doing basic life support, which is chest compressions and breathing? If you're at the veterinary hospital, it's good to know ahead of time, like, is this a dog that we should do open heart or open chest CPR on? Like, how far do you want to go? Because it's really hard to make that choice in the middle of the shock and the trauma that you've already endured seeing your pet in that situation. So think about it ahead of time, and talk to your family about your own personal pets. Talk to Rachel if you have a dog that's in her ownership through Lily's pad, just to make sure everyone's on the same page. Like, how far are we going to go before we get to that event? And you can see Collie has a plan at all times for all the cheese. All the cheese. So, an ounce of prevention, as you guys all are aware of, you can even hear in the room, airway obstruction is one of the biggest issues with bulldogs, especially English and Frenchies. Some things that can cause airway obstruction, especially in these breeds, are aspiration pneumonia, where they vomited and then inhaled it. And now we have a pneumonia in there that sometimes they don't even show us signs of until we have an issue. They can have foreign objects stuck in there. They can get an insect bite or sting, causing facial swelling. And honestly, word of advice from this vet, if they have been stung on the face, or you even suspect they've been stung on the face, just give Benadryl. Like, it's not going to hurt. Here's the dose that I would want you to give rather than trying to find it online. 1 milligram per pound. They come in 25 milligram tablets. They can cause a little bit of sedation, which isn't necessarily a bad thing in a bulldog that just got stung. We want them to take nice, even breaths. They can become a little bit hyperactive on it. The only ones I've seen that happen with are usually the younger kids, and it's pretty rare. And it's not like, it's just like, woo, 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 which they'll probably already be doing if they've been stung by a bee. Anyway, so just to prevent facial swelling from being an issue, go ahead and give the Benadryl. And then we're also going to talk about complications from brachycephalic syndrome and what that means. And that includes edema in the tissues of the throat, and that can be from heat, that can be from panting really hard, it can be from stress. So these are all things that we worry about with these guys. So brachycephalic syndrome, I'm going to talk about this a little bit so you guys have an idea about the anatomy that plays a role in what's going on with your bulldogs. So first of all, brachycephalic just means short-nosed dog. We've taken their cooling system that should be this long and it's now this short. And we have some issues with that that have developed over the years of breeding. First of all, they can develop stenotic nares, and you can see on here, I hope you can see on here, how tight these little nostrils are, versus this is a dog that was after I did surgery to widen the nostrils. They're much bigger. And this is something that we can do prophylactically. I do this a lot during spays and neuters, especially Frenchies. Some of them will have totally fine soft palate, but their nose is wound tight, and they cannot breathe through their nose at all. So that's definitely a form of airway obstruction. Do you have any more chairs?
Do you need a chair? Do you need more chairs? Okay.
So stenotic nares. We're starting up at the most pointy end, and it's already obstructed. The next part that these guys have issues with is their palate is longer than it should be. And what we're looking at here, this should be a wide open hole to breathe through. It is not. It is a big pile of pink flesh. And what we're looking at, this is the epiglottis, and it should be at the bottom of the throat. And we should have a nice airway. You can see down here where the tube is passed into that airway. This is a soft palate that's been trimmed back. This is one that has not, and it's like a flap. It just seals over that airway. And that's one of the biggest issues that we see with these guys when they're in trouble. So this would be the area that we would trim back if we were doing surgery on this dog prophylactically. And we trim it back to the level of the tonsils. These are the tonsils right here. You can see on this picture too, the other thing that we have a problem with the brachycephalic syndrome is everted laryngeal saccules. And there's these little tiny saccules on either side of the larynx. And when we have high pressure going down that wind tube, because they're panting so hard, it makes those saccules pop out, unfortunately, further obstructing their airway. And on this one, this was a little, I think this was a Shih Tzu I did surgery on, but you can see this little tiny pink pop-up thing on the edge here. It's less pronounced in a Shih Tzu than it would be in a Bulldog. In a Bulldog, this guy's like, woo. And this is something that usually when we're doing this surgery, we'll go ahead and snip those out too if we can see them, if they're popped out. The fourth part of brachycephalic syndrome, and this is something that not every brachycephalic dog has, but some of them do, and we should be aware of it, is a hypoplastic trachea. And what that means is their windpipe is actually much smaller than it should be. This is outlining what a normal trachea should look like on an x-ray. The skull is over on this side, the lungs are going this way, and you can see it's nice and wide. This is a Bulldog. See how tiny that little straw is that they're trying to breathe through. And this is a big dog, trying to breathe through this tiny little hole. And now we've added on stenotic nares. We've added on this big fleshy soft palate. We've also added on these little saccules that are popped out and obstructing the airway too. So we got a lot stacked against them as far as breathing is concerned. Again, this isn't every dog, but it's important to know. And this is why sometimes we'll have a dog that's as big as Bella up here, and we'll be able to put in a trach tube for surgery that is like the size of a giant cat, because their trachea is just not big enough to handle a bigger tube. So, and it's something that we can tell usually on x-rays before we go in. Whenever I'm doing anesthesia on brachycephalic dogs, especially ones that are older and bigger, I do recommend doing chest x-rays just to make sure we're not dealing with this ahead of time. Although usually they've shown us that they're having trouble breathing before then, and we can anticipate we're going to need a smaller tube. Side note, with anesthesia on brachycephalic breeds, we leave that tube in as long as possible. Sometimes they just walk around with it in their mouth because they can breathe so well. They're like, ha! It's really cute. We've got a couple pictures of, I think I have a pug that was just walking around. We don't pull the tube until they can swallow and protect their airway, but some of them are like, I'm good.
So I have a question. So on dogs like this, then, are you able to go in and actually put in a section of tubing that helps, that would stay permanent?
Yeah, like a stent.
Yeah.
You can't on this type of case. It's not something that is collapsing, it's something that just isn't big enough. So we can't force it to be bigger. The tissue of the trachea is really rigid and cartilaginous. If we have collapsing trachea on top of this, which is another horrible sequela that can happen, where you see where it's so wide up here in the trachea, if they have really weak cartilaginous rings, suddenly when they're breathing and it's a high pressure high pressure system, the trachea will go and seal down while they're trying to breathe. And then in that case, they can go in surgically and place a stent to hold it open. That's usually really common with Yorkies, who are also considered brachycephalic dogs. They have a shorter nose, but they usually have collapsing trachea too. I shouldn't say usually, some of them do. I see mostly rescue Yorkies, and they usually have some kind of affect on their respiratory tract. So yeah, this is just to give you guys, again, an overview of the anatomy that we're dealing with when we're trying to do CPR on them, or even rescue breathing. So brachycephalic syndrome, we know most bulldogs have compromised airways, and it's important to know what we're up against. And then we just need to be really aware of what they can handle. You know, be aware of the heat. I always cringe if I see bulldogs out walking around in 90-degree days. I'm like, oh my gosh, get your dog inside. Because as they pant harder and harder, that tissue is going to swell. All that extra tissue is going to swell. And then we're going to get into trouble. Also stress. Talk to your vet about options with stress. Many of you guys have stress kiddos that will trigger under certain circumstances. And if they're breathing hard, again, all that tissue swells, and that already narrowed airway is getting smaller and smaller and smaller. Some things that you can do ahead of time to counteract stress. Talk to us about pheromone therapy. I really like the adaptive pheromones we have in the rooms here. They don't have any side effects. They don't hurt. They might help. I'd say we use them everywhere in our hospital, and I'd say probably about 60 to 70% of the dogs have a really positive reaction to them. The others are like, meh, whatever, give me cheese.
Oh, that was nice.
Is the mystery solved?
Yeah, I guess so. He said, I must see that beautiful Bella.
Oh, that
Hey,
is
baby.
happy. Are you happy now? Everybody's happy? Yeah. You can calm down now.
Oh, you guys.
Oh, okay.
He's a lover.
Other things that can help if we can anticipate it ahead of time, using anti-anxiety drugs like gabapentin, trazodone. For some dogs, clonidine is important. We just have to figure out like what's the right cocktail for each individual dog, and that can take a little bit to tweak that, and also figure out what's the time frame for giving that. For some of them, it's 2 hours ahead of doing a stressful event. For others, it might need to be longer, just to have an onset. Most of the anti-anxiety meds work better on an empty stomach. So keep that in mind too. You might see a significant difference between empty stomach and full stomach, especially with trazodone. If you know that you're going to be using it for something like a big trip or a plane ride or anything that you know is coming, 4th of July is coming, air show is coming, let's try to nail down that cocktail before the day of. Work with us on that. We're happy to help. But we need you to try giving it at home, and then let's go for a car ride. Let's test this out. Is this enough or is this too much? We want to have that plan before it's a holiday, and you have to call the ER because the dog's too sleepy or not sleepy enough, and we're worried about our stress attack. Make sense? So the intent of CPR is to circulate the blood around the brain and the organs until you can get to a hospital where they can actually intervene and do more advanced life support. And you need to keep in mind most patients can't be saved. So what that means for you is that it's not going to hurt to try. If you have an unconscious dog, go for it. Just go ahead and do it. Don't worry about, am I going to do harm? If they're out, that's your one chance of saving them. And it's good to know you have something you can do. Come on in, guys. And then most dogs that do arrest even if you get them back, they're going to arrest again in the next 48 hours. So we need to get to the hospital and have the reason why they arrested worked up thoroughly so we can stop it from happening again.
That's good to know.
Yes. So in 2012, the veterinary community got together and said, we need to do better about CPR. Like, we have a cat?
I don't have a cat. I don't.
Oh, I think it was coming through.
Okay. Like, I didn't bring a cat.
In human medicine, and these are numbers from humans and animals that are in a hospital setting. So we have to make very clear, hospital setting where they have everything at their disposal. The recovery rate with CPR in humans was 20% versus animals, which was 6 to 7%. Not great. And we looked at it and said, hey, we think we can do better than that. So 100 specialists that are in emergency and critical care or that are boarded in veterinary anesthesia got together and looked at the evidence-based medicine across all the species, across human medicine, but particularly in dogs and cats, to say what is the best thing to do here? What's going to work? What can we do to increase these odds? And so they released these guidelines. They're called the Recover Guidelines, Recovery Initiative. You can find them online. They are updated frequently, depending on studies that are being done every single year. And it has subsequently improved our chance of getting them back. One hospital that has incorporated the Recover Initiative has had over 24% recovery when they're doing CPR. Now, I want to qualify that because only 3.7% survive to discharge from the hospital setting. So, like I said, a lot of animals that code have an underlying problem that needs to be addressed. And these are, again, from a hospital, so these are really sick animals. The majority of bulldogs that we deal with, it usually starts with an airway issue. So we're going to go into that in some more detail. Average duration of CPR that led to return of circulation is about 9.5 minutes. So it's going to feel like a really long minute.
That is a very long time.
Yeah, it feels like forever. And if an animal arrests, like I said, they're likely to do it again. So you just, like, we're trying to do basic life support while driving to the hospital. Like, we have to get them where we can get them more stable, even if we get them back. So there's two parts to CPR. The first part that I think is going to be the most important for these guys is rescue breathing. And the first thing you want to do is check the airway. Make sure that we don't have anything in there like a piece of kibble, especially if we have a tiny little airway. Did we chew our food? Did we shovel it in and now we're choking on it? I have a dog that comes in for canine fitness training. We have to tear up marshmallows for them into tiny pieces because she will just suck them down and then be like, ah, and have to cough it back out. So if your dog eats their food really fast and is suddenly turning blue, the first thing you're going to want to do is check their airway. One of the reasons I put this particular picture on here, you see all this flesh that's in the way? This is our airway right here going into the trachea. And this is the soft palate, this pink thing coming down here that's already partially causing an obstruction. This is our big, meaty bulldog tongue that is also in the way, and this is our tiny little airway. Our stenotic nares, we've got a nasal passage, and it's trying to pass air behind this soft palate, but if this soft palate is swollen, there's not a lot of air for it to even come through the nasal passage. So the first thing I want any of you guys to do, pull out the tongue. Pull it, stretch it way out as far as you can, because that in and of itself can open up that airway. So if they've stopped breathing and we're turning blue, but we still have a heart rate, pull that tongue out. We're trying to decrease all this flesh that's blocking the airway. So pull that tongue out, clearing obstruction. Right down here by the larynx, these guys have essentially like an Adam's apple too. Big bony apparatus, it's called the hyoid apparatus, and it's a bunch of little bones that connect. And you can feel it on you too, but feel it on your dogs as well. You don't want to think that that's an obstruction and pull it out. We've actually had people that thought their dog was choking, stuck their hand down, they're like, I felt something bony, so I shoved it, or I grabbed it and pulled. Now we have introduced trauma to that area too. So be aware there is a bony apparatus down in there that needs to stay there. It's helping to prop everything open. So it's not a bone, don't pull it out. So the other thing you want to do is extend their head and neck. Again, if we can take this and stretch this way, we're going to hopefully straighten out all of this tissue so that we have a clear shot into the air pipe. If we're not, and then once you have the airway all cleared, wait for about 10 seconds and watch them. You okay? You need to clear your airway?
Go for it. Go for it, Dr.
It's like
Rosie.
suction. If we are not breathing and it's been 10 seconds, it's time to start doing rescue breathing. One thing that I have found to be helpful is having a bulb syringe or bulb suction. You guys know what those are? So if you have like a puppy that might regurge, or any animal that might regurge, a lot of the Frenchies will sometimes have a little regurge problem, and they sound like they're becoming obstructed with that, get that suction bulb in there and just get the goo out, if they'll let you. If they're fighting you off, that's a good sign. They probably have enough oxygen. But if you see that they're struggling, and the first thing you want to do is stick your finger in, try to clear it out. If you can't, try to use that suction bulb syringe. You can also use it in the nose if you see vomit coming out their nose. So this is where we want to start with our rescue breathing. We haven't seen a breath in 10 seconds. We've extended the head and neck. We've pulled that tongue out. Their airway is clear, and they're still not breathing. So what we're going to do next, you're going to keep that tongue pulled forward while closing the snout over it. And if you can use two hands, it gives you a better seal around the lips. With these guys, luckily, there's not a whole lot of pointiness that you have to pinch off. So just going over their nose and holding their mouth shut but having the tongue out. And then you can seal over the nose with your mouth and blow into those nostrils. If you feel like those nostrils are so occluded you are not getting air in, you can try parting the mouth a little bit, making a tube around the whole area and breathing that way too. I'd say it's pretty rare that, especially with the force that we can produce, that you can't get air past even those stenotic nostrils, but you never know. Some of these guys are really tight up there. You want to breathe into those nostrils until you see the chest expand. If the chest isn't expanding, we're not getting the air in there. You don't want to over-expand the chest, you just want to see it move out a little bit. And that way you know we've filled those lungs with air. So once you have your seal, you want to give 3 to 5 full breaths and then check breathing and heart function. If you see that the stomach is distending, because this is going to happen, it happens even in hospital during CPR. If we're giving breath, the stomach will sometimes fill up with air as well. So the problem with that is there's that diaphragm and it sits right over the stomach. And if the stomach's full of air and we're trying to put air in the lungs and it's pushing against this diaphragm and we have a bunch of air in the stomach, it can't move. Like we can't get that diaphragm to expand to fill those lungs. So occasionally it's best if you can gently push on the stomach and try to almost burp them. There's not going to be a lot of resistance because they're usually unconscious. But trying to push the air out of the stomach a little bit so we're not fighting against this big air bubble in the abdomen. Let's see. So there was a study recently on swine, and they didn't see any difference in how well the blood circulated, what the neurologic function was on recovery, and how they did afterwards if you did ventilation or not. Because if you do compressions alone, it might move enough air to ventilate them. So if you're like on your own and you have to choose between ventilating them and doing chest compressions, do the chest compressions. If you were looking at a dog and you're like, there's no way I can put my mouth on that mouth, whether they have dental disease or you're immune compromised or you just don't want to do it, but you want to do something, do the chest compressions. And then if the breathing is shallow or not existent and the pet is unconscious, keep breathing for them about 10 times a minute. And what that looks like is 1 breath about every 6 seconds. So breathe, 2, 3, 4, 5. Breathe, 2, 3, 4, 5. To check the heart and see if we have a heart rate, the best way to do it is to move these guys' elbow up to their rib cage, and that's where the heart's going to be. So that's a little cheater if you're like, I don't know what to feel or where to feel.
You move, so you with their front leg. You
Yep,
just
move the front
up
leg,
and then
just
under.
flex, and it's going to be right where the elbow is on the rib cage. And that's where you're going to want to put your hand to feel for a heart rate. That's going to be your best chance. With bulldogs, since they're so barrel-chested, you might have to really make sure that you're underneath them, because that heart, it's not pinned in place. It's going to move around. So if they're on their side, that heart's going to go thunk to the side. If they're on their back, it's going to be deep. If they're sternal, it's probably going to be the best way that you're going to be able to feel it, is if they're on 4 legs, you're kind of supporting them, and you can feel where that elbow meets the chest on their, right at their breastbone, essentially. If you don't feel that heart rate, start chest compressions. Another place to feel, again, it can be tricky in the bulldogs because they are so deep chested, and if that heart is right in the middle and there's like fat around the base of it, you might not be able to feel it up against the chest wall. So in that case, you want to check for pulses instead. And pulses, we're going to feel right on the insides of the thighs and the back legs. You guys probably see us do this during the exam, where we move our hands down their back and right inside their legs. There's that major artery and vein right on the insides of the thighs. And try this at home with your pets. Don't push